The Commerce Department is looking into placing new tariffs on medical devices and supplies. It's supposed to make a decision pretty soon. So, at a time when people are already facing an energy crisis and inflation, the federal government might raise your medical costs. More tariffs are going to raise the cost of these products, and as we've seen over and over again, that cost is going to be passed on to the people. So, more trade barriers mean longer waits for people who need medicine and working equipment today, not months from now. As we've seen, rural hospitals and community clinics operate on thin margins already. Higher costs on essential equipment mean delayed upgrades, reduced services, or actually both. Now, the U.S. has designated the medical supply chain as a matter of national security, but undermining that supply chain doesn't strengthen national security, it does the opposite. And in doing so, it weakens our ability to care for people who need help the most. If we're going to make the national security argument, it requires medical supply chain resilience. That comes from stable, predictable trade relationships with our allies, not new restrictions that create uncertainty in the market. So the question for policymakers isn't really whether trade policy matters, it's whether the next decision on this actually protects people or adds new barriers to their healthcare.